at 9.
It's Men's Health Week. Really, is it the whole month, Dr. Lutz? I feel like, yes. So you guys get the whole month, okay? So
we'll take it.
Live it up. Because then after that, it's all about the women. Dr. Michael Lutz, Michigan Men's Health Foundation is here. How are you?
Oh, great. Great to be here.
Good to see you. Looking all refreshed and enjoying a little bit of retirement life.
A little bit.
It's all that movement.
And moving around. So we want to talk to you about a couple of things that, and Ryan is joining us because he's passionate about movement, and that's kind of your campaign too, is let's move. And why is that so important when you talk about men's health?
Well, when you think about it, globally, 2 million people are dying every year just because of sedentary lifestyles.
Really?
Up to 85% of people in the world are sedentary, don't do anything. And so it's really simple. 150 minutes a week of just minimal activity, mild activity. And how can you do it? 3,000 steps, 30 minutes. Very simple. That's moderate. You burn about 5 calories a minute. If you really want to step it up, 75 minutes a week. So you go ahead and you start really jogging or biking. Here's the real data. Over 500,000 people were studied prospectively. And what did they find? They found that if you do 15 minutes of activity a day, you can reduce your death rate by 15%. And every 15 minutes a day you add, another 5%, which means you could probably live forever. But I don't think that's really been proven.
Just walk your way into forever. So that's good. I know you heard Ryan talking about his new passion for walking. And,
sure, I love it.
It can be, walking sounds so simple, but we always say it can be one of the best exercises because it's so accessible.
And it clears your head.
Yeah.
I mean, it makes the whole day just go away and get better. I mean, my wife always knew when I came home from work, the first thing I was doing was putting on my running shoes.
Yeah.
And, I got my 30 minutes of running in. The rest of the night was perfect.
Dr. Lutz, I wanted to talk to you. You have a follow-up,
please,
right?
please.
I want to talk about prostate cancer screening because this weekend you have a big Run for the Ribbon event happening that celebrates survivorship. But we're a little confused when it comes to screening for prostate cancer. And, Ryan, you have special family circumstances, too.
Yeah, my dad had prostate cancer, so I got screened at an early age. And I think the screening part of it is one of the reasons why more men don't go get screened, and that seems to be changing the way we screen for prostate cancer. Can you speak to that?
It really is. The American Urologic Association, which is our parent organization, is telling us to start getting rid of the digital rectal examination because it's so inaccurate in discovering prostate cancer, and using the PSA blood test, the prostatic specific antigen blood test, is actually a very effective way of finding out who may be at increased risk. Now, we know that there are men that are at increased risk for prostate cancer, men of African descent, firefighters, if you have a family history of prostate cancer, if you're a fighter pilot. These people are at increased risk of prostate cancer, need to start earlier at age 40. And being followed on an annual basis to see if there's changes in that PSA. The changes in the PSA and the actual level can be determinative of an increased risk of prostate cancer. And then the next step might be a liquid biopsy test, a blood, urine, or saliva test that is being developed and implemented now instead of going right to biopsy.
Wow. Okay, I want to put up the recommendations because I think this is confusing, and we talked a little bit about this when former President Joe Biden came out with his late-stage diagnosis of prostate cancer in his 80s. So here is, and you speak to this, Dr. Lutz, this is what we're seeing as the official recommendation. So 55 to 69, it's case by case. 70 or older, no screening recommended. What do we do with that? What are we telling our fathers and our grandfathers?
I call it diagnostic ageism. We really are ruling out after age 70 any further screening opportunities, and nothing could be further from the truth. Your chronologic age and your physiologic age is not always the same. And so what I tell most people is if you have at least 10 years of survivorship left within you, then you should get screened, because that's what you need to know.
Yeah.
And so I have had men in their 70s and 80s getting screened for prostate cancer because I could tell that they're physically fit. They're going to be around for a while. So don't let the chronological age be the determining factor. Take a look at who you are physically and then make the assessment.
Let's talk about what's happening this weekend.
Yeah, Run for the Ribbon this weekend. It's a huge event at the Detroit Zoo every year. And what year is this? Is it 15?
Well, we started our first run in 2009, and we get over 1,000 attendees every
Wow.
year. And you don't have to be a prostate cancer survivor to come to this event. You can just be doing it for Dad that day. And what really makes it an awesome event is that it brings families together. The running bib that you sign up for actually gets you into the zoo for free afterwards, so you can spend some time at the zoo and enjoy the penguins. And so it's a lot of fun.
Awesome. I do want to
stuff.
point out as well, if I could, September 20th this year. Get that date on your calendar because it is so important for men specifically to get checked out. And we as men have an opportunity to go for free to Ford Field. It is the men's health event. Cost is not a barrier. It is totally free. September 20th, Men's Health Foundation free health event. Get checked out.
And just as a tease, we're going to offer a special blood test this year at our men's health event that could be life-changing.
That event has changed lives.
Yeah.
That is not an exaggeration. So, and it was all started by this guy. Dr. Lutz, thank you.
Thank you so much, Doctor.
Thank you. Thanks for being
popping
here.
in. We have more.